you could have all the health insurance you want. And so I see something that I now realize from what happened today and the good work that Sheila Jackson Lee has done. And when I gave her permission to do this here, I wasn't thinking about anything like that. I was, look, you want a hearing on health care? Let's have another one. What's wrong with one more hearing between friends? But hey, this was not another hearing. Now, look, I think it's also comparable to going to church. Everybody doesn't get to, you go to church and somebody jumps up, and if you're in some of the churches that I go to, you may start dancing or yelling or strutting or tongues come into play. Hey, but this is what happened to me today. Some people can leave the Judiciary Committee today and say, well, that was a very good hearing. And I like this witness was very, oh, and did you hear the doctor from Yale? Look, this was a moment in time that cannot be replicated. And so I am transformed. I'm affected deeply by what was said and the exchanges that went on. And you know, there's some things you can't script, and sometimes you can plan for a hearing. We have hearings. I've missed 2 Judiciary Committee hearings, and I realized, I don't know how many people have said, I've got to take, you can only be in one place at one time. Now there's 3 good things, very important things going on, but you can only be at one. And I heard something, and here's what it is. I heard it, that this goes as important and fundamental as health care is. And you know, being a committee of mostly lawyers, we begin to see that this is constitutionally mandated. We begin to see that it's in the 14th Amendment. We begin to see it's in the preamble. Then we begin to see that it's in the international laws of humanity. It's internationally encoded into all countries, all nations, all systems. And so we now begin to understand that this issue goes beyond its subject matter. This is deeper than healthcare. Yes. We're talking about the way people relate to people on earth. And this doesn't come to you all the time. You don't, look, you got health care, right. You got mandatory minimum sentences, right. You got full employment. We're trying to keep Obama out of Afghanistan, right. We're trying to do this, that, and the other. All important, individually important, significant unto themselves. But here, we got into the system. And I began to see past the subject matter into what kind of a nation we're going to be measured as when we, the most powerful country in recorded civilization, comes up 37th in the World Health Organization's evaluations of nations. 37. We spend far more than any country on earth. And yet, we have the best medical schools in the world. We have the best research going on, healthcare research. We have the best training. We have the best facilities, library, professors. Everything is the best. That's why everybody wants to come to America. But our system is corrupted by corporate greed. And after a while, you start thinking underneath all of this, how can the city that I represent, that we both grew up in, have the highest unemployment rate in the United States? 28.6% unemployed. The highest. But the worst part is that the unofficial rate is even higher. So we're talking about a third to maybe somewhere almost reaching half the people not working regularly. And so that feeds into another problem. Namely, that there are people that are working that know they can get a notice next week that we're closing down and our company's moving out. So you talk about a stress factor. You got a job. Nobody said anything about reducing the staff or the employees, but you're reading the paper. Neither did these 200 people whose company was closed down yesterday. They didn't think they didn't know. So we're in a perilous situation. And now that the lunch has arrived, I would like to be the very first person to go through the line and set the precedent for what it is you're supposed to do when you go through this line. Okay?
Thank you. That was awesome.